Hello, today we are going to discuss about the radiation caries. I'll be covering this topic under the following headings. First of all, the definition, etiology, diagnosis of radiation caries, clinical feature, and finally the management of radiation caries along with the preventive measures. Radiation caries is a type of dental decay that occurs as a result of exposure to the radiations, typically from a cancer treatment involving the head and neck region. It results from the reduced salivary flow, which is known as xerostomia, due to damage to the salivary glands, changes in the oral environment, and alteration in the composition of saliva in terms of buffering capacity, quality, and quantity. Pathophysiology of radiation caries starts when the radiation damages the salivary gland, leading to a significant reduction in the saliva protection. Radiation alters the viscosity and buffering capacity of saliva, making it less effective in neutralizing acids and washing away food particles. Reduction in the saliva and changes in the composition favors the growth of the cariogenic bacteria like Streptococcus mutans. The residual saliva in individuals with a xerostomia also has a lower concentration of calcium ion. This results in greater solubility of the tooth structure and reduced remineralization capacity of the tooth. Accurate diagnosis can be made by taking the thorough history and the clinical examination of the patient, which include the radiation treatment history, onset of the symptoms, and the dry mouth history. Along with the history and the clinical examination, radiographs can be taken in identifying the extent of the caries in any underlying bone involvement. Radiation caries typically present as a rapid circumferential decay around the cervical areas of the teeth. It commonly affects the cervical regions, incisal edges, and the cusp tip of the teeth. It rapidly progresses and can lead to the significant tooth structure loss and eventual tooth fracture. Clinically, radiation caries they begin on labial surface at the cervical areas of the teeth, and caries affect the smooth surfaces including the mandibular anterior teeth, which are unexpected since these areas are most resistant to caries in the non-radiated population. Clinically, three patterns of radiation caries exist. Type 1 is the most common type and it affects the cervical aspect of the teeth and extends to cemento-enamel junction. A circumferential decay develops and the crown amputation often occurs. Type 2 radiation caries appear as the area of demineralization on all the dental surfaces. Generalized erosion and worn out occlusal in the incisal surfaces are also seen. Type 3 pattern of radiation caries is the least common pattern and it is seen as the color changes in the dentine. The crown appears dark brown black and occlusal and incisal rear can be seen. Now we'll come to the management part. The best method to reduce the radiation caries is daily application of viscous topical 1% neutral sodium fluoride gel in the custom made applicator trays. The best results are achieved from the combination of the restorative procedures, excellent oral hygiene, a diet restricted in cariogenic foods, and the topical application of sodium fluoride. Facial cooperation is maintaining oral hygiene is extremely important because radiation caries is a lifelong threat. Teeth with the gross caries or the periodontal involvement are often extracted before the radiation treatment is given. So this was all about the radiation caries and its management. Hope you like my video. Please subscribe to my channel. If you have any comment regarding any video, you may put it in the comment box. I'll definitely will try to solve the query. So thank you. Thanks a lot. Have a nice day.